start your
Hey, everybody, it's Dr. David. So, welcome to another exciting edition of Ask Dr. David Live. Got a bunch of questions that have come in. For those who don't know, I am a board certified pediatrician in Tampa, Florida. This is part of my YouTube channel. We allow people to submit questions. We first take questions from our Patreon subscribers. So if you ever want first dibs, please be a subscriber on our Patreon channel. Also, we will then go through questions that other people submit. And then if I have time at the end, which sometimes I do, sometimes I don't, I'll be able to take additional questions that are being submitted, but it will come in order. So if you have any questions, please send them in. Now, as far as a quick disclaimer, this is for general medical purposes. This is not meant to diagnose, treat, or all those other things you hear on commercials about supplements and things like that. But specific medical questions, we do need to keep those to like consultations and such. Another something, so, and you may have gotten, if you're on our email list, you may have gotten the message yesterday, but I am doing a benefit concert. So for those who don't know, I have a band, Dr. David and Friends. I have another band, Some Assembly Required, but Dr. David and Friends will be playing on December 3rd. It's at 2 p.m. is when the gates open at the Tiki Cove, which is just up North Dale Mabry in the New Tampa. Actually, that's more in the Lutz Land Lakes area. And this is going to be a benefit for the Penguin Project. You may have heard me talk about it before. This is a program for young actors who have special needs. All of the actors, and they are all matched up with their own penguins, which they're peer mentors who are there to help them through the entire staging process, their rehearsals, through their choreography, help with any lines. And then we put on a production at the in the springtime, and it's just wonderful. And if you haven't had the opportunity to see one, please do check that out. You can get all of the information at drdavidmd.com. If you scroll down, you'll see it. I think if you go /concert, you'll find it there on drdavidmd.com /concert. So please check it out. Please share it with other people. It'll be a great event. It looks like the weather's going to be really nice with the early forecast. It's out on a lake. This beautiful, very Key Westy Hawaiian kind of atmosphere to it. So yeah, hope you can make it. Okay, now behind the scenes is Shari, who is going to be feeding me all the questions as we go, which means I need to actually come over there and turn that on. Where are the questions at? Here we go. Okay. Alrighty, so Shari, do we have any questions so far? Okay, here we go. Okay. So, hello, Dr. David. I was wondering if you are familiar and recommend treatments, therapies, etc., for teens with phobias. For example, the phobia of throwing up. Physical conditions can make a person nauseous, not having established. The cause of the nausea has not been established, but the fear of throwing up is bigger than actually the possibility of throwing up itself due to GI issues. Okay, so when we are talking about phobias, it's obviously a mental health thing, not a physical health. Now, of course, there are people who can be triggered by certain smells, sights, memories, medications. Obviously, there are things that can make people throw up. But of course, when a person has a phobia, that is a bit of a challenge. Okay, now when dealing with phobias, the most helpful types of treatments is usually cognitive behavioral therapy, exposure therapy. Okay. Now, this, of course, if a person knows what their triggers are, there can be some gradual exposures to that particular trigger. But if there's not a trigger, that can't be done. But in terms of whatever it is that a person is fearful of, and this is something you really need to work with a therapist who is trained in cognitive behavioral therapy, specifically for things like anxiety and OCDs. But there are very, very small incremental exposures to whatever it is that phobia is. So, for instance, it could be starting off by just like writing out the word throwing up or vomiting and doing that hundreds of times just to feel comfortable with it. Maybe after a little bit of time, with the therapist working on it, where you actually maybe look at some pictures of it, but again, small, like maybe for a second and take it away, and type of gradual exposures. Obviously, I don't expect anybody to be actually physically walking around hoping to smell some vomit, even though that of course can be a trigger too. But since this is just more a fear of it, it's more just kind of getting used to it. I mean, I'm Guessing on YouTube, there's probably are videos of people throwing up too, but that'll be much, much later. But realistically, there, all phobias are pretty much handled the same way. Okay. Now, of course, if phobias themselves, because it is a branch of anxiety, of course, there could be all kinds of treatments, natural and pharmacological, that can be helped to reduce anxiety as a whole, which can be helpful in terms of reducing that trigger level for the person. But really working with a therapist who knows what they're doing, how they can expose the person gradually to it, is probably the best chance for long-term success. Okay. Next question being loaded up here. Okay. Okay. So for over 6 years, every time that our son gets sick with any virus, whether COVID, regular strep, etc., his cough sounds like a croupy cough, like a dry cough, even though it's not croup. Have you ever seen this before? And do you have any ideas for what could be causing this? It happens every time he's sick. We hear that cough medicines are not safe for kids and teens, but the homeopathic cough syrups that we have tried have not been helpful. We also understand there could be an underlying cause. Okay. So for those who don't know, croup is a term for para-influenza that can cause this like barky like cough. Okay. But it's not specific only to that one virus. Okay. Other viruses can cause it again. And the way that I look at it, because some people, like when they get a virus, they may have that type of cough. Some people, when they get a virus, they may be more prone to wheezing. In fact, that's me. Thankfully, my asthma, pretty much in terms of allergies and stuff, has been resolved. But if I get a upper respiratory infection, I may go into a little bit of a wheeze. But thankfully, it's not there, and it's controlled by my inhalers. But when a person's having a croupy type of cough, that is considered more of an upper airway, like trachea on up through the larynx type of location, as opposed to down in the lungs. Okay. Now I'm assuming that the cough has been listened to and make sure there is no lung involvement. Of course, if not, then it probably should be listened to at some point. But if it resolves on its own, there's a couple questions that I have, like how long is it lasting for, but also how problematic is it to the patient themselves? Okay. And if they're just going on their business and they know it's going to get better, I don't know how much needs to be worked up about it. However, one of the questions that could come up is, could there be maybe some type of anatomical issue, maybe some narrowing of the airway, or the larynx, the trachea, etc. With any type of airway or passageway as a whole, it can make a sound if it's narrowed. Think of a garden hose. Okay. If you step on a garden hose, whether you step on the middle or more towards the end of it, it changes the flow and it can change the sound that's coming out at the end. Okay. So if there is some kind of, there's laryngomalacias, there's other types of things that may not be impactful on somebody unless they have some mucus there, unless they have some narrowing of the airway. So that's the type of thing that an ENT or a pulmonologist may be able to examine. Sometimes there does need to be a scope there where they can even see, is there any narrowing of the airway there? But that would really be the type of thing that I would be considering of if, and of course, starting the immune support protocol as soon as possible, including a high push for anti-inflammatory natural remedies. And I know that in the protocols that I've posted before, even on the treating COVID and respiratory viruses, there's a section there specifically where we talk about things like high dose omega-3 fatty acids, curcumins, N-acetylcysteine, glutathione, things that we can do to help reduce inflammation. But the goal, if this is how that kid is, you want to start things, not just the core 4 supplements that we do normally, but you may want to start those types of things at the beginning of an illness, just in order to try to keep the inflammation from going. Because as we've talked about before, inflammation is our immune system's response to the infection, not the infection itself. So the more that we can be in anti-inflammatory mode, then the more likely that we will not have more narrowing of the airway. Okay. All right. Hi, this is a selfless question. Oh, that's nice to have, because this is actually for my PCP who I love. Well, that's very sweet. I'm glad that you have a nice relationship with your PCP. Everyone should have one. But she has hemifacial spasms and was told the only way to help is to either Botox shots or a very risky surgery. Do you know of any alternative treatments for something like this? Okay. So for those who don't know, it's kind of like it's a hemi means half. And it can be just a spasming of one of it is half of the face, kind of like a twitch, like a spasm that's neuromuscular. Okay. So when I think of any kind of neuromuscular issue, whether it's tics, etc., muscle spasms. I'm thinking about things like magnesium. I'm thinking like things like theanine. I'm thinking like things that just cannabinoids that can help reduce the imbalance in neurological system. And I'm also thinking about inflammation. So as I've talked about before, most of our inflammation does start in the gut. So clean gut, healthy microbiome, good prebiotics, all those types of things could be potentially helpful as well. But in general, when I think, again, things that calm the nerves would be kind of what I'd be thinking about if I was working that patient up and making some suggestions. So hope that helps. All right. How often is it average for typical kids to get sick? Okay. So we need to define this by what their other exposures are. What I mean by that is the first year that a child is around a significant group of other children, whether it's in daycare, preschool, kindergarten. If they haven't been exposed to lots of other germs, then they're going to get exposed to everything. Okay. And it is not uncommon. In fact, it's felt in pediatrics. We learned this the first year in residency. A kid the first year can be sick 10 times. And that's almost once a month. And it's also known that a runny nose, congestion, can last for 2 weeks and a cough up to 4 weeks. And that's normal. Again, assuming there's no difficulty breathing, shortness of breath, or any other kind of respiratory issues. And of course, if that happens 10 times a year, your kid could be snotty 20 weeks and coughing 40 weeks out of the year. That's almost the entire year. But that is normal. So as long as there is not that worsening that's going on, of course, if you're ever worried about your kid, as opposed to, man, this stinks type of cough, then you let it ride. Now, once a kid starts getting older and they've been exposed to everything, then usually it's more 3 to 4 times a year is probably, if that. Okay. Now, of course, those of us who have been around infections enough, such as myself, you can think about it. I'm a pediatrician. I'm around sick people all the time. Snotty nosed kids. I got to get up in there. I got to look in their ears, all that stuff. Yet I rarely get sick. It's because I've been exposed to everything over the last 25 years, repeatedly. Now, it's interesting. I know I've shared with this before on the channel. When it came to COVID, okay, because of the quarantining, because of the lockdown that we had, because for a period of time, people were more conscious about not exposing themselves to others if they were sick, or being more conscious of not going into closed areas. We had a period of time where a bunch of people, most people, did not get exposed to viruses on the regular basis for like the 2 to 3 years. Now, because of that, it kind of resets people's immune system. So it's not that unusual that this year, even if a person's an older and have been around other kids, this may be a little bit rougher of a year. In fact, last year I talked about how there was the concern about influenza, RSV, and COVID all appearing at the same time. And there were reports around the country, and there was certainly a lot of talk about this. I personally didn't see much of that. And so, I guess that concern is there, as we get into the winter respiratory viruses. And, usually we see a COVID spike in the summer and then another one in the winter. So, all of these germs get together. They're going to cause symptoms on people. So, that's why we always say you don't know what you have until you're further into it. So don't wait that long. And again, start the immune support protocol, the supplements there, and, take it easy, make sure that don't go to school, don't go to work if you have a fever, if you feel lousy, if you feel fluish, if you're sweaty it up. Don't go. Chill. Take it easy. Take a day off. You're allowed to. Okay, your body needs to heal. Don't run yourself ragged. But otherwise, and obviously, if there is more of a concern, but if a kid's getting sick more than 10 times a year, I would also say it may not be a bad idea at that point to be doing an immunological workup. Just, there's blood tests that can be done that look at the types of white blood cells, that look at the antibodies, the immunoglobulins. So there is lots of evaluation that can be done if necessary. And of course, I would first and foremost want to make sure that people have optimal middle level vitamin D levels and zinc levels. Okay. What are the pros and cons of using berberine for weight loss or insulin resistance? Okay, that's actually a good question. Berberine is one of the first herbs that I actually learned about. And it's naturally found in a few things, but mostly in golden seal. I think goldenrod has it too. So this goes back to my days at Tampa General when I was allowed to start using herbs after an article came out in our pediatric journal that was called Contemporary Pediatrics. It was an AAP, Academy of Pediatrics sponsored journal, and I was allowed to use them because it was in there. And so it was like echinacea was in there, golden seal, mahuang, feverfew, a few other things were in there. But for in the pediatric world, we were using it more for natural antibiotic, antiviral types of things, and I continued to use it to that day. But it has gotten some second wind now as a potential weight loss slash insulin diabetes control, and I've seen it bantered about as like natural Ozempic and stuff like that, which I think is way overstating because of what we know. Now, there is some preliminary research that does show that it may be helpful in weight loss and it may be helpful for insulin resistance, diabetes, etc. Okay. It is a generally regarded as safe supplement. So as long as people aren't taking superhuman amounts, there's really not a danger to it. Although if you take too much, you can get most common side effect is GI disturbances, nausea, etc. So what I would say is if a person is going to use it, of course, it should be under the guidance of a medical doctor. It also should be in under the with hopefully that person would be checking their insulin levels all the time. Anyways, obviously weight loss is weight loss. You'll see whether that's happening. But of course, now there is some drug interactions. Like one of the most common for type 2 diabetes is metformin, and there is actually a contraindication for when people take metformin and berberine golden seal. But as long as a person is measuring their blood glucose on a very regular basis and making sure that it's not going too low, because obviously if you're taking insulin and then you take something that also may low, we want to make sure you don't go hypoglycemic, low blood sugar. But it does seem as if it's a pretty safe thing for people to try. I'm not really sure in terms of what types of dosings that is out there. Haven't really studied it on that level, but I've heard about it and I've read about it a little bit. So maybe it'll be something promising that we'll have in the future. And obviously, anytime we can do nature as medicine as opposed to pharmaceuticals, especially considering how much the costs of some of these new weight loss diabetes control medications are, if they're not covered, berberine probably would be a cheaper option too. All right. Can you talk about the recent news reports on cannabis use and cardiovascular disease? Yeah, so this kind of made a little splash. There was an article that I saw on CNN, I think it was last week, and it talked about all these concerns but then, and this is where when you're reading a news article, you really need to deep dive and know what you're looking for. Because when I started reading through this, the first thing that it said, like I think it was in the second paragraph, was that it was that these were two unpublished studies. Now, first of all, why on earth is the news reporting on an unpublished, which means it hasn't been peer reviewed? Okay. But also because it's not published, I couldn't even read about it. So there were so many questions that I had. Was it just smoking? Was it vaping? Or I don't know, or what percentage? But also, what were people doing? Okay. Because, even when I talked about, what levels of impurities are people, are they all medical and they're checking everything, but even the types of products, some people, um, if they're using a more pure product, like what would dry herb vaping flower be compared to smoking it, which I think would probably be more of an issue, or versus vaping it, which depending on how that goes, we know that there could be things within the vape oils themselves, some of the flavorings that are out there. Also, the processing, is it made with solvents or is it done with a live rosin that's just that only heat and pressure are what's used to extract the cannabinoids? Was it an isolate of it? Was there terpenes involved? Was it a whole plant type of medicine? So, it frustrated me because I actually tried to find the articles themselves. By all means, if anybody's seen these unpublished studies, please put it in the comments section and let me know, because I would like to do it, because certainly, it was a concern. Obviously, I don't want my patients developing cardiovascular disease. And, obviously people should be under a medical doctor's guidance where they're checking these types of things. And of course, having their cholesterol checked and their pressure checked and their hearts listened to and lungs listened to on an annual basis, so you can catch those things. I can tell you from, my experience in the cannabis clinic, I haven't really seen any problems with it. Again, I realize that because our patients are really looking at dosing under medical guidance, and having things checked, maybe that's the reason why. I don't know. But I sure would like to have some more information. And I think it was kind of irresponsible for CNN to put this in, because it kind of made a big headline. But it's like, well, you're only giving part of the story here. And like, it just seemed like, I mean, I have problems with that. If you're concerned, look at the source, because I've also seen plenty of studies that when you actually look at and the actual data that they provide, I'm like, that's not what they said. That's not what they said at all. But yet, the headline gets seen by everybody and then they scroll on past it. So yeah, that's that. Why are prebiotics important? Well, that's a great question. Okay, so everybody's kind of heard of probiotics, and probiotics, whether in a food source, cultured foods, fermented foods, or in supplements when people take a supplemental probiotic, they are used in order to nourish, to optimize the levels of the good bacteria in our gut. Okay, and they're responsible for helping keep the integrity of the lining of the intestines intact, so anti-leaky gut. And they make certain vitamins, like you need this bacteria to make vitamin K, to make vitamin D. And we get exposed to the sun, but there's a conversion that also still has to happen. And so vitamin K is important there. So I didn't mean to say vitamin D. I meant to say vitamin K. Excuse me. It's the skin and the kidneys that need processing through the vitamin D. So I want to be accurate there. So prebiotics is the food that feeds those good bacteria. Okay. They're most commonly found in fibrous foods, and especially unsoluble fiber, because you don't want it to be soluble to get into the bloodstream. You want it to be unsoluble so it gets to the colon, which is where most of the good bacteria lies. Okay. Now, nuts and seeds and um, high fibery vegetables and fruits, those are going to be your mainstays. Okay. A typical person, to get the types of fiber that they need, should be having at least 5 servings of vegetable. A serving is really the size of their palm, so a kid's serving and a adult serving is not necessarily the same. And less of the fruits, but if you're doing a fruit, obviously not juices, because juicing, whether it's fruits or vegetables, spits the fiber out, and you're not getting any prebiotic. You're just basically getting juice. And at that point, it's just sugar. But so that's why we want to talk about eating the whole fruit, not just not juicing it. Now, one of the other interesting things that is kind of becoming very interesting is something which are called human milk oligosaccharides, which are HMOs, but not the insurance kind HMO. And I learned a bit about this at a medical conference a couple weeks ago, and this is something that exists in mother's milk. But it's interesting because there's absolutely no nutritional value to the baby that's nursing. It's all there just to feed the bifidobacteria to help the gut grow and mature. So unlike babies, when they're born sterile, but usually the main probiotic the main flora that starts to grow is Bifidophilus. And you may have even heard about a product called In Vivo, which is a Bifidophilus infantalis, which is a particular probiotic that we use, especially if a baby had to be exposed to antibiotics, or the mom had to be exposed during antibiotics, or if it's a C-section and we want to get the good bacteria. And we also talk about vaginal seeding with the mother's own vaginal juices as another way of doing that. But these prebiotics, these human milk oligosaccharides, and we didn't really know about these, about 10 years ago, 5 years ago. I don't think, maybe 10. But now, I mean, because like, why would it be in the breast milk if there's no nutritional value? But the answer is because you are what you eat, and these bacteria that we are seeded with, it's felt that within the first 3 years of life, our probiotic flora, our microbiome is kind of set. And what I mean by that is, if you take foods that are fermented, or if you take supplements, yes, they'll be there, but they don't stick to the lining. They don't stay there. And that's what, because if you think about it, these are bacteria. When you are exposed to things very early in life, you look at it as self. So our baby's body doesn't see those flora as something that's foreign, as it's something that's supposed to be there. Okay. And that's why it's facilitated and allowed to grow. And then it kind of sets up shop. And then you have a beautiful garden, hopefully with lots of different types of bacteria. That's why we talk about consuming lots of different types of fermented foods, which is still better to me than any probiotic that's out there, just because of the diversity of the bacteria there. But prebiotics as a whole, you need it there to feed it. We talk about older kids and adults getting even, at least 25 grams of fiber for actually for kids, adults 35 to 40 grams of fiber a day. But again, it needs to be some insoluble fiber as a prebiotic in order for you to get the most out of it. But that whole thing, which fixing the leaky gut, that's what lowers the inflammation, or at least lowers the inflammatory potential, because of the potential things when a leaky gut, substances get into the bloodstream, stimulates the immune system, cytokines come and all of that. So we want to keep everything contained in the gut until we fully digest our food down to our most basic small peptides, amino acids, proteins, and carbohydrates. Okay, so this is a related question, which is actually the last question for today. Okay, are there any supplements other than probiotics that are helpful to take while antibiotics and after antibiotics treatment to help the body to detox? Okay, well, let's break down what we mean by detox, because in a body, as with many medications, we do clear it out of our body through our livers, through time, etc. Most medicines are out of our bodies within what we call 5 half-lives. Every single medication has its own half-life. So there's some medications that could be 3 to 4 hours. And that means the amount that once it hits a blood level, how much time does it take to cut that amount by half? That's what a half-life is. And after 4 to 5, it's considered pretty much clean. So it doesn't, so antibiotics don't typically stick around. That you need to be talking about a long-term detoxification for it. Dealing with the aftermath of the antibiotics, because it can kill off the good flora, is certainly a thing. Okay, so now we talked about probiotics, but I want to talk specifically in this case about a particular one called Saccharomyces boulardii. Saccharomyces boulardii. It's a cousin of baker's yeast or brewer's yeast. It's a friendly yeast, and it does not get killed by an antibiotic because it's not a bacteria. It's a fungus. It's a friendly yeast. Okay, so we use this as kind of like a space saver. Okay, yes, we're giving the probiotics, but I also like to give the Saccharomyces boulardii at the same time, because if the good guys, whether it's the probiotics that you're trying to give or the good guys that are supposed to be there, are being knocked out by the antibiotics, you want the space saver. You want it to be kind of lining the intestinal lining with this. Now, it doesn't stick around long term, but until you're a couple of weeks after the antibiotic is, and it's all cleared from the body, then you kind of know that you can stop those the Saccharomyces. But it is felt that every time a person takes an antibiotic, it does take about 4 months for their gut to come back. Okay, and obviously doing these types of things will speed it up. But of course, that's why we also talk about trying to be on antibiotics for as short of a period of time as possible. Why we talk about trying to use the weakest antibiotic that will still work and not using any of the big guns, because they're more likely to kill off more of the good guys as well. All right, so there we are, pretty much at a half hour. So, we will continue to do this monthly. Again, if you didn't hear it before, please check out at drdavidmd.com, where if you scroll a little bit, you'll see about the benefit concert that I'm doing for the Penguin Project, an organization that does musical theater for young actors, to children and young adults with special needs. Also, if you haven't subscribed to us on this channel, please do so. I also do some more shorter videos and such on both YouTube Shorts as well as on TikTok. And of course, if you're not a member of our Patreon, to get some of those benefits there too. One of the things that's there is also all my immune support protocols and my primary care protocols that we usually reserve for our practice. I have put them there as well. So please also sign up for our newsletter, which you can do so also at Dr. David MD, and then you will get notified when these come out. You can submit questions ahead of time. Hope you all have a great day and have a great Thanksgiving coming up, and I'll chat at you in December. Bye-bye.